Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my left is Premier John Horgan. To my right, Dr. Bonnie Henry, BC's Provincial Health Officer, and the lead of our BC immunization team, Dr. Ballem. And we're honored, all of us are honored to be here. Today, you're going to be hearing a presentation from the Premier and then presentations with the deck from first Dr. Henry and then Dr. Ballem. There's going to be a lot of information on our acceleration of our vaccination program in British Columbia. Our regular report on case counts and other COVID-19 issues will be coming in written form at 3 o'clock. And so you'll get that information there, but this is an extremely full session and we wanted to leave lots of time for questions. And with that, it's my honor to introduce, always, Premier John Horgan.
Thank you, Adrian, for that introduction and for the territorial acknowledgements of the Songhees Nisquamish First Nations. I want to, at the outset, on behalf of all British Columbians, say thank you to the three of you, to Adrian, to Penny, and to Bonnie, for the extraordinary work they've been doing over the past number of months to prepare for the beginning of the end of our challenges with COVID-19. Of course, our plan, our immunization plan, has been very fluid, and that's been explained, I think, extensively over the past number of weeks as we depend on supply from offshore to meet the expectations of British Columbians. But today, we have additional good news to add, and I'll leave most of that to Dr. Henry and Dr. Ballem. But we've already vaccinated hundreds of thousands of seniors, with hundreds of thousands more being ready to be vaccinated in the weeks ahead. The next cohort, from 75 to 79, will be able to begin appointments in the days ahead, and Dr. Ballem will speak specifically to that. What I want to talk about today is the amount of AstraZeneca vaccine we have at our disposal. You'll remember back on March 9th, we received our first 68,000 doses of the AstraZeneca vaccine, and we expect to see in British Columbia over 340,000 doses of AstraZeneca by late May. Having another safe, effective vaccine means that we can protect more people faster. Over the coming months, that shipment will mean 300,000 people from frontline workplaces will be able to get vaccinated outside of their age cohort. That means that people who are working that cannot work remotely, people who are in outbreaks already, people who cannot work with full PPE or barriers in place, or people who live in congregate settings will be able to be included to this list. And that includes people who work in our schools and our childcare centers, first responders like firefighters and police, people who work in grocery stores, manufacturing, and food processing. And I'm pleased to share with you that this work will be done in concert with community pharmacists through our existing clinics, as well as the mobile clinics that have been so effective to administer these vaccines to workers right across British Columbia. Now, we know this has been an extremely challenging time for frontline workers. While many of us have been able to work remotely or from home, they have gone to work day after day, day after day, and they are the true heroes that we want to immunize at this time. In order for us to protect everyone, we have to start with the most vulnerable. We've made that abundantly clear. Dr. Ballem and Dr. Henry will focus on that as we move through the Pfizer and Moderna supplies that are coming our way. But if we're going to reduce outbreaks in communities, outbreaks in workplaces, utilizing the AstraZeneca vaccine will make us all safer and British Columbians all better off. We are in the final stretch. But this is the most important time in any race. This is the most important time in any challenge we face as individuals, as a community, and as a province. We must remain vigilant and listen and focus on the orders that Dr. Henry has put in place to protect all of us. The vaccines will put us in a much better place in the days and weeks and months ahead, but until that happens, each and every one of us has an obligation to our neighbors, to our communities, to make sure that we're following those guidelines. I'm very excited about the news that Dr. Ballem and Dr. Henry are going to be sharing with us today. This means we're closer to the end. But again, vigilance needs to be the order of the day. British Columbians have done such a spectacular job at this point in time. Let's not let each other down now. Thank you very much.
Thank you and good afternoon. So I am very pleased to be able to talk today about where we're going forward in our program using the AstraZeneca COVISHIELD vaccines that we have now in British Columbia. As you know, we had said from the very beginning that once we had a fridge-stable vaccine that would allow us the flexibility to use in more places around the province, we would be targeted at frontline workers and workers in specific at-risk workplaces and industries. We now have 2 vaccines that have been approved for use by Health Canada, one of which we've had in the province, and that's the AstraZeneca or COVISHIELD, which is the Serum Institute of India version of the same vaccine. It's approved by Health Canada and now by NACI for use in adults over the age of 18. And our BC Immunization Committee has been tasked with providing us with the best advice of where we can make the most difference and how to start the use of this vaccine. So the rollout is in 2 parts, the first of which started just this week. The part 1 was the COVISHIELD that we received, 68,000 doses that we received last week. That has now been started to being used in places across the province, and I'll provide more details about that. In addition, we now know that we will be receiving another close to 300,000 doses starting, we hope, the last week of March, but we don't have that pinned down quite yet. So it will be the last week of March or the first week of April, and 136,000 doses of the COVISHIELD in mid-April, and another 68,000 doses in May. So those are what we are using now to plan the part 2 of this use of this new and effective vaccine. We also heard today on media reports that we might be getting additional doses from the United States. So that will allow us to actually speed up, again, some of those processes. So this is our updated progress using the phases that we have had from the very beginning. And what we're focusing on right now is that gray box down in the bottom, which is the priority frontline workers or people who work in specific industries that are at risk. The part 1, which I've just mentioned, based on the 68,000 doses that we received last week, this is being deployed based on what we know from public health and from the WorkSafe BC and Public Health Workplace Task Group that I put together last November to help us address the ongoing issues that we were seeing in many workplaces around COVID-19 outbreaks and helping boost and the COVID safety plans to prevent outbreaks. But we do know that there are a number of industries that are more at risk, and they are having ongoing and repeated outbreaks. They have unique issues where it's difficult to have physical distancing, where wearing of PPE becomes challenging because of the nature of the work that people are doing. And we know that they're susceptible to ongoing outbreaks, and poultry plants are one of the ones that come to mind. As well, we know that we have ongoing risk and outbreaks associated with congregate housing facilities for workers, whether it's agricultural workers, whether it's workers in some of the resort communities, for example, in Whistler or Big White. So our delivery method in the past week has been around using on-site clinics so that we are able to target workers directly, and that will continue. And for some workers, we've managed to move them in a separate stream through some of our clinics. So where have we seen this rollout so far? The key sectors that we know are the most challenging in terms of managing of outbreaks are food processing plants, and we've seen outbreaks that have affected many people in poultry processing, fruit, vegetable, fish, and meat processing around the province. We know as well that the agricultural operations that have the congregate worker accommodations in farms, nurseries, and greenhouses that are so essential to keeping food on the table across this province. And this is highly supported by our temporary foreign worker program that in BC we've been supporting through providing of a centralized quarantine services where temporary farm workers who are so necessary for this work are quarantined safely and provided what they need. And we'll be looking at immunizing and just started that program, immunizing those workers so that when they go into our communities, we don't see the outbreaks that we saw last year. As well, we know that there's been challenges with the large industrial camps, and we put in place a Provincial Health Officer order around industrial camps to enhance the measures that are put in place. And despite that, we know that there were challenges with workers who come in and out from communities around BC and from other parts of Canada, and they bring the risk with them to these congregate living settings in these accommodations and the large camps, and they take the risk back home with them. So we have been working particularly in the north and the interior to address the risk in those worker populations. We have other large congregate living settings, particularly, as I mentioned, in resort community where isolation and quarantine is very challenging, and where young people are having difficulty with maintaining the distance and the isolation that's needed with these ongoing outbreaks. And additionally, we have a number of workplaces and industries, including manufacturing, warehousing, distribution, where we have ongoing clusters and outbreaks occurring. Generally, they're larger sites. We're focusing on those where we can make the most difference with preventing the second-generation transmission in those outbreaks. And we've seen some of those be responded to in this past week. And I know that there's sometimes some frustration expressed when we are immunizing people and workers who have an outbreak or have been exposed in a large Costco or a glass manufacturing. But these are all places where we know there's been exposure, where we know that transmission between workers also puts our communities at risk when people go home, and it is in all of our best interest to protect everybody in that situation. So what have we been doing? The part one, focusing on these, including it in Vancouver Coastal Health, about 16,000 doses to people working in 53 identified food processing facilities, 6 industrial sites, and 5 congregate living settings, as well as the temporary foreign workers who are in isolation in the Richmond area. In Fraser Health, where the largest proportion of these sites are, we're working on immunizing in 71 food processing plants, 48 farms, nurseries, and greenhouses, and a number of industrial work sites with outbreaks. Interior Health has a smaller group of people, primarily focused on industrial work camps and food processing, and a number of larger farms and nurseries with shared accommodations. When we look at Northern Health, as I mentioned, that's where a large industrial camps have meant ongoing risk to neighboring communities as well as outbreaks in the camps themselves. Island Health doesn't have as many of these types of settings, but there are 4 of the large food production facilities that will be targeted. And then we have some doses in reserves for those larger outbreaks that we're trying to manage in different parts of the province. As we move into the second part, when we receive the next shipment of AstraZeneca vaccine, which is, as I mentioned, we're expecting the last week of March or the first week of April, we are going to be refining and moving out to a new group of people as well. So the target groups and the management of outbreaks will continue. All of the important things that we're looking at is all of our data needs to be entered into our provincial immunization registry on a daily basis. This is critical for all of us, and it is something we have focused on from the very beginning, making sure that every dose, every lot number that everybody receives is in our provincial registry, not only so that you have a record of what vaccine you received and when, but it's an important part of our safety monitoring. So we monitor that information by lot number, by every vaccine on an ongoing and daily basis so that we're able to see if signals arise. And we know this is the same process that's happening around the world. We share information, and we've heard about some of the concerns expressed with vaccines in Europe, and it was a safety signal from this type of monitoring that allowed them to take a pause and look and assess those instances. And we're very pleased that we have not seen any of the same types of issues here in British Columbia. In Canada, we've seen one clotting event related to AstraZeneca that was, temporarily related to vaccination, but not related to the vaccine. And again, today, EMA, the European Medicines Association, has come out with a strong support for the risks of vaccination being very low compared to the risks that we have with ongoing transmission of COVID in our communities right now. The eligibility of people for these programs will be validated before they're immunized, and it is important for us in public health to ensure that people recognize how getting vaccine as quickly as possible into as many people as possible helps break those chains of transmission, those clusters and outbreaks in our community, as we are working at the same time with the bulk of our program to protect those people who are most at risk. And we'll have some more information about that coming up. So any of the vaccines that are not yet used from Part 1 will be added into the initiative in the Part 2. We know that people who are affected are people who live across the province in different sectors. Our implementation is going to be more flexible now, using partners in our community. And I have asked and tasked our BC Immunization Committee with looking at all of the recommendations that we have from national bodies, from looking at our outbreak and case data that we have here in BC, and importantly, using our ethical framework for vaccines that helps us determine the parameters that we want to use to identify who should be immunized first in this part of our parallel program. So with that in mind, what we are looking at is the priority groups for Part 2, starting in April, will be first responders, police, fire, and those who work in our emergency medical transport, where we know that maintaining that workforce is an important service, and we have these duty of reciprocity. We'll be focusing as well on K-12 education staff and childcare staff in both licensed and family child daycares across the province, as we know how important it is and how critical it is for families and communities across the province that safe childcare and in-person education is for us all, and the amazing job that we know the early childhood educators, our educators, and our childcare providers have been doing throughout this pandemic. We will also be focusing again on those higher risk industries where we're seeing challenges, including manufacturing, and there's sectors that have been where outbreaks have been ongoing and have been identified, wholesale and warehousing, including particularly food warehousing, staff and congregate housing. As I mentioned, some have been addressed starting in the Part 1 of this program. Correctional facilities staff, again, some of the staff have been addressed because we've had ongoing outbreaks in our provincial correctional services and federal correctional facilities, and the inmates in the federal correctional facilities are covered under the federal program, but both federal and provincial staff will be covered under this program. As well, we're looking at cross-border transport, and we're working with the Ministry of Transportation and Infrastructure to identify exactly who the groups are at risk in these communities. Smaller groups of people, including our quarantine officers and bylaw officers. We'll be looking at postal workers, as we know that is also an environment where we're seeing ongoing outbreaks. And many of us, of course, are dependent on the packages that get sent around the country these days. And finally, grocery store workers. And we'll be defining those more clearly for people as we work through this. There'll be hopefully some as well that we can use to continue to target those outbreaks that we're seeing now. So this is approximately 320,000 workers identified in these target groups. Some will already have been started to be immunized in this Part 1 that we're doing right now, and we've been working on the scenario of about an 80% uptake. As I mentioned, this is a fridge-stable vaccine, so that means we can use the infrastructure that we have in our community, and particularly our community providers, pharmacies specifically, and we've been working with the pharmacy associations to make sure that we can do this in an efficient way, and we know that there are many pharmacies and pharmacists who have been part of our influenza immunization program that are ready and able to take this up. About 60%, as you can see from our targeted groups, are people who can be identified through their identification related to their work. And then we'll be focusing the remainder of the activities on the 40% where we will be doing health authority-driven clinics on site, some of which have started already. So this allows us to really move ahead with our large shipment of this vaccine to target these groups of people who we know are essential for keeping our communities going and who have been working throughout this pandemic. And I know there are many other groups that fall into this category as well. And as more vaccine becomes available and our age-based program moves along, we'll also be targeting additional worker groups as we need until we get everybody in BC who wants to be immunized over the age of every adult in British Columbia and in the coming months. And until then, as the Premier has mentioned, we all need to do our part. Do our part to keep us going, to reduce the transmission in our communities as we protect more and more people through the use of our immunization programs. I'm now going to turn it over to Dr. Ballem to talk about then optimizing our deployment.
Thanks so much, Dr. Henry, Premier, Minister. It's a privilege to be here today and very exciting to just be able to share with you the really remarkable progress that we're making as a province, getting everyone to get the jab, as we say. So this slide is a familiar one for you. It lays out the phases of our campaign that we've been working on, and I think what's critical today is, you've heard Dr. Henry speak about the AstraZeneca and COVISHIELD vaccine and the target groups. And I want to share with you more detail on the more familiar vaccines that we've been working with since December, the Moderna and Pfizer, and how the decisions that have been made and the supply that's arrived just since we last spoke March 1st have really upped the opportunity for us to continue to protect our public. So just to give you a bit of a sense of, how we're doing, there's been a total of 444,000 doses of vaccine administered to our BC public, mostly on age cohorts, as you know, but also in our priority populations over the work we've done in phase 1 and phase 2. And, you can see that Pfizer vaccine so far is the majority of the vaccine that we've used, with Moderna in second place. And, just to share with you the volumes that we're now moving to in the last couple of days since we started our mass immunization clinics for our population in their 80s and 90s, we're doing about 20,000 vaccinations a day in British Columbia. So that's a remarkable increase, and you can start to see the numbers starting to ratchet up as we're moving people through all of the clinics around the province. So, really understanding what's happened since March 1st. On March 1st, we shared with you that we had about 415,000 doses of Pfizer and Moderna coming to the province. And we described the rollout of our phase 2, which was priority populations and our age-related cohorts over 80 and our Indigenous people over the age of 65. But since that time, just in these last couple of weeks, we have gone from 415,000 doses to actually now a projected supply for March and the middle of April of actually close to 1 million doses of vaccine. So really a doubling of what we can expect. So, and essentially we also have the added AstraZeneca COVISHIELD vaccine that Dr. Henry's already talked to you about. We do know that Johnson & Johnson has approved, their vaccine has been approved in Canada, We have no line of sight at this point into what supply Canada will be bringing forth or when it will arrive. So I think it's, you know, one of the fundamental pieces of information here is that we're in a very fluid environment, as the Premier said. Things are changing as we go through our days and weeks, and you know, the job that we have in our health sector and our partners who are helping us deliver this campaign is we have to be nimble. We have to be able to react to these changes and, you know, continue to clarify and keep our focus on our objective, which is to get our population vaccinated and protected, to protect our workers, and to keep our health system, you know, strong and protected from COVID, and, you know, to actually carry on addressing the pandemic, because it's still with us until we get our herd immunized. So this slide actually shows you a little bit of the elephant that we're going to be swallowing between now and the, you know, the middle and end of April. You can see that this very rapid rise in the amount of available vaccine in the space of just a month and a half. And, you know, I'm very happy to report that our whole program for immunization has been able to adjust to this. And what I'm going to share with you is, you know, what that means for our public in terms of their ability to get vaccinated. So if you just looking at this slide, you can see in the pink, that's the Pfizer vaccine, and you can see the rapid increase in Pfizer, and the gray is Moderna, and then the black part of the slide shows the AstraZeneca COVISHIELD vaccine that will be coming to us. So in the next slide, I'm going to just walk you through a little bit of the math around here, because one of the important things when you're rolling out an immunization campaign and staffing up clinics to do it is, and in, you know, the many communities around our province where this has to happen, it's not linear, it's all happening pretty much at the same time and in a complex schedule. So we really have to know what vaccine we have available and where we have to have it located, and then what's the target population that we're reaching in those communities around the province. So at a very high level, the vaccine supply, we had, you know, if we took March 12th as the starting date of our analysis, had about 75,000 of vaccine on hand that had just arrived late in the week. We have Pfizer shipments coming in between March 12th and April 18th of about 661,000. And then we have Moderna shipments, which, as you'll remember, come every 2 to 3 weeks, arriving between the same period of time, March 12th to April 18th, of about 170,000. And that totals just under 1,906,059 units. And, you know, as you know, the change that allowed this to happen was really increased supply and the shift from, and the extension of the dose 2. Because as soon as we extended dose 2 to 16 weeks, what that allowed us, it freed up, you know, thousands of doses of these vaccines to allow expanded access for vaccination to our population by dose 1, which, as Dr. Henry has described, is very protective. So basically, if you go back to our original plan that we rolled out on March 1st, we were launching the vaccination of the over 80s, the over 65, our Indigenous population. In some areas, we described that the communities would be vaccinated actually as a whole. In very small communities around different parts of our province, it's not a good use of time or resources to come back several times. And so in those communities, usually less than 2,500 will vaccinate the whole population when our teams arrive from the health authority. We continue on an ongoing basis to vaccinate our priority populations. You'll have heard that many health workers, particularly now in the community, are being vaccinated. Our allied health professions, our nurses and support workers who are looking after people on long-term home support, a whole array of direct care providers in our community, physicians, and so on. And we continue to work across the province with the First Nations Health Authority. I'm really happy to report that we're, you know, well underway to finish off by the end of March all our First Nations sites, our reserve communities across the province. So very good news for a population that we know has an increased level of adverse events from this virus. So looking at the available supply of vaccine and taking away the plan that we already had underway, we have about just over 500,000 doses of Pfizer and Moderna that we now had to decide, okay, how are we going to use these? So if you go to the next slide, just to remind you, although these present just logistical challenges to our sector to, on a very short timeline, get this rolled out, it's an incredible opportunity for our province in terms of getting back to normal, because this is another 500,000 people that are going to get vaccinated in a very near time frame. It allows us to move up those age cohorts that we had sort of set out to through April, May, and June. And, you know, really, we're just expediting the protection of our public. So it's very, very good news for both the general population, Indigenous peoples, and, as you've heard from Dr. Henry, our workers. So when looking at how we were going to use this vaccine in a short time frame, we're going to move up the next age cohort from 70 to 79. And although we were going to start on those individuals in April, we're now able to move some of them up into this month, into March, in our clinics. We've already undertaken to expand the clinics that were set up for the over 80s, and we will be welcoming and, you know, basically going out to the public to tell people in their, and we'll start with the 75 to 79 cohort and just let them know that we will be in a segmented way asking them to call in and make their appointments in the coming days. So just looking at the math, it's about close to 350,000 that we expect will be coming in to get vaccinated in their 70s. Now, we have another group that Dr. Henry has referenced on a number of occasions, and that's our clinically extremely vulnerable group. This is a group of about 200,000 individuals. About 50,000 of those actually will be covered in the older age group in the 70s, 75 to 79, and some of them will already have been vaccinated in the 80-year-old age group. But beyond that, there's a remaining 151,000. And those individuals, you know, cross all age ranges. And you'll remember that we laid out the different categories they fall in back in January. They're people who are on, you know, very powerful immunosuppressants, organ transplant recipients who are still on immunosuppressants, people in active chemotherapy and radiation therapy, a whole array of groups that our medical community recognize are significantly at risk, and we'll be coming out in the coming days to just make clear what those groups are, and those groups will be receiving a personalized letter from the ministry and the PHSA, who's in charge of this program, and advising them that they're eligible to get vaccinated regardless of their age. So between those two groups, we will cover off the extra 500,000 doses of Pfizer and Moderna that are coming to us. When we look at the feasibility for the different health authorities to actually ramp up this activity, I would say in the Lower Mainland, both Vancouver Coastal and Fraser have more large clinics. It's a bit easier and it will be faster for them to expedite opening up more capacity. And in the interior, the north and Vancouver Island, particularly in the northern part of Vancouver Island, they'll be working hard with us to ramp up their activity, probably a bit more back-end loaded toward the middle of April. So we're very confident that we are going to be able to use this vaccine in a very timely, expedited way to move up our population protection. So, this slide just very simply walks you through the numbers of the different groups and shows you that at the end of it all, we have about 44,000 doses of vaccine that we will either have used up because we get more than 80% uptake, which is about our average, or we'll roll into the group receiving vaccines, the next age cohort after April 18th. I just want to note that we will be keeping a reserve of vaccine, and that's because it's not uncommon for our Pfizer, and particularly for Moderna, which only arrives once in a 2-week time frame, to come a few days late. And although during the first 2 phases of our campaign, we were able to manage that because we were working with our own staff who were getting vaccinated and different priority populations. And we were able to reschedule them and move on. But with the volumes now that we're going to be vaccinating, and the fact that it involves, large numbers of people in our general public, we do not want to be canceling vaccination clinics that have already been scheduled. And so we're keeping a bit of a reserve, about 140,000 doses, which is 3 days supply to actually make sure we've got that nimbleness. And if the things arrive a bit late, that we're able to fill in that gap and proceed as planned with our scheduled clinics. The next slide just shows you, you'll have seen in the last week, I think we all experienced the call center issues we had on the first day of our rollout, which is a very typical experience across our country and other jurisdictions around the world. You know, when you first open up your clinics to the general public, they're very enthusiastic, and that's good news. We want them to want to get vaccinated and to be getting in there to get an appointment. But it really challenges the technology of call centers and online registration. So, you know, what we moved to was a segmented process, and we've been working with our partners at our TELUS call center to segment the population, and I'm very, very happy to report that our public they understand the need for that, why it works better for them. We have virtually no wait times on our call centers the end of last week and this week, and yet we're scheduling even more people every day. So segmentation of the age group seems, you know, pretty practical and simple, and so this is just an example of what our planned schedule for segmenting our 75 to 79 age group for next week will be. And, you know, these things may shift a little bit, but essentially it's really about protecting our public from having to wait in long queues that are not necessary. If they wait till their age cohort is called by year and year of birth, you know, they will get a very fast response and be able to book their appointment. And what we know is when people have an appointment booked, they just relax and they feel very, very confident and, you know, really much safer. And I just think that our experience really over the last week has been incredibly heartwarming. Seeing all these seniors come in and get their vaccination, and really they're so happy and they're crying, and it's just really been a remarkable thing for all our staff to just see just the impact of these clinics on our population. Now, going back to sort of the impact on the health authorities and just being able to understand, you know, what they'll be doing in order to respond to this increased vaccine. On the top line of this slide, you see incremental clinic bookings. And essentially, you know, it's about 420,000 that we expect to drive through our immunization clinics. And you can see by health authority the range of you know, increased activity that they'll be managing, not just in one clinic, but in clinics spread around their whole geographic region. With Fraser Health Authority, you know, having the highest amount, and that basically relates to their large population. And interestingly, the interior, Vancouver Coastal, and Vancouver Island all have about the same number, because Vancouver Island and IHA actually have, you know, even more seniors in their 70s than even Vancouver Coastal. So these things, you know, as you go through different age groups, you have to watch the impact on the different authorities and make sure that they've got the proper support to be able to respond. And the next line just really gives you an idea of, you know, what the burden on a daily basis of additional clinic visits will be across our clinics. About half of the 150,000 clinically extremely vulnerable patients will come in through our clinics, and the other half will organize their access through different programs across, really provided by the PHSA. You know, many of the programs in which these patients reside are run as provincial programs, the transplant program, our cancer centers, you know, small groups like patients with cystic fibrosis. They will then, the other groups, those with severe asthma and COPD, and those patients with severe diabetes as examples, those people on immunosuppressants are quite large groups, and those we expect that they'll flow through our immunization clinics. You know, just a note about our smaller health authorities, they're working hard in every community, because these patients are spread across our whole province, to make sure that, you know, as quickly as possible, we're ramping up the capacity, you know, to see these patients and our age cohorts into their clinics. So moving on to just deployment of the vaccine, I talked about the scheduling. We're very happy with our call center. We will be bringing online our provincial digital platform that I've talked to you about before. It's a great system. I think it's making Dr. Henry very, very happy. It's basically a massive transformation of our ability, in our immunization programs, throughout the age groups and all different kinds of vaccines. This will allow us to track everyone. It will provide an opportunity a few months down the road for the public to access their vaccine records, and for physicians and pharmacists to actually make sure they are able to access those supplies when they're seeing patients. And we've talked about the AstraZeneca rollout as well, and how that will happen, in great partnership with our community pharmacies. So just moving on to this slide, because the transformation and transition to the provincial digital platform is a tricky business. As you know, we're working currently with 5 call centers in the health authorities, and they will continue to schedule people right up to April 18th and get them scheduled in all these clinics. There's about 198 clinics currently, and that will drop down a bit as we get our oldest seniors through. But, in the range of 170 clinics around the province, and we will continue to schedule them through our 5 call centers over the course of the next few weeks. And then on April 6th, we will do the shift over. And we will close down those 5 call centers and those numbers, and we will move to 1 provincial call center and 1 very robust online booking platform. And the public will then start to be able to access, wherever they are, that online system and or the call center who can help them book an appointment. And that is what we will proceed through the rest of our vaccination and immunization program for COVID-19 using that platform. And just a little bit about that platform, it will allow people to go in and register pretty much at any time. We have mechanisms to gate that so it doesn't collapse under the enthusiasm of the remaining people to be vaccinated coming in. It will then allow you to schedule an appointment. You'll get a reminder that you can schedule an appointment. And the reason for that is we can gate that so we don't have everyone scheduling at the same time. And then it will actually run our clinics. We will be using the same system in our clinics and tracking all the different work processes in the clinic. And finally, it will be a remarkable tool for reporting out, for us to track our business and how we're doing, and to continue to adjust our processes. So in summary, so this is our vaccination timeline now, moving up, as you can see. This is very, very good news for us. So, in March, we will, we're continuing to do those who are aged 80 and Indigenous peoples. In April, and even before April, we are probably going to get some people in their 70s into our clinics to vaccinate them as we incrementally bring on capacity. And in May, we'll be at a minimum, pending new news about new vaccine arriving, people aged 59 down to 40, and in June, we'll get our younger group vaccinated. And, this is remarkable progress if you think back to January when we were talking about September to get this done. Now, we will have second doses, and that will happen, in a structured way, consistent with the evidence, as Dr. Henry has indicated. And in the meantime, you can see in the yellow across the bottom of this slide that we'll have all of these different worker groups in the AstraZeneca COVISHIELD program who will also contribute to the protection of our population. So in summary, as of March 12th, we're looking at a bounty of vaccine, which is, a remarkable opportunity. We are working very hard to respond to that and move up our population, accelerate their vaccination and their protection. This is a real benefit, particularly in the Lower Mainland, where we have an outbreak that is particularly difficult. And so it helps all of these things. It helps us manage our pandemic, protect our hospitals, and, advance the protection of our population. And by our calculation, just with the Pfizer and Moderna, without considering the impact of AstraZeneca, we will have about a quarter of our population vaccinated by the end of next month. So the additional coverage by AstraZeneca will contribute to this, but, essentially this is good news for our public. Very happy to be here, announcing this, and there will be more to come. Thank you so much.
Some smiling people, for sure. So I'm here and we're underway.
Yes, thank you. As a reminder to all reporters on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. First question is from Lisa Eusden, News 1130.
Oh my God, you guys make me work hard when you come first to me. Thank you so much. One question I have about the vaccinations, Dr. Henry, that are being done in these work sites that you mentioned that people have some concerns about, the ones like Costco and the glass place. People still wondering why, when they can quarantine at home and it takes 3 weeks for vaccinations to kick in, why not just isolate those people and do some that are more immediately at risk?
Yeah, and this is an ongoing question that we get. There's a couple of reasons for that. The workplaces that we're talking about are ones where we have large numbers of people, where there are already exposures, where there's ongoing risk, and so they're not the workplaces that are small that we can effectively. And the other part that we are looking at from the public health perspective, and it's the MHOs in the regional health authorities that are making these decisions based on the risk that we know in those communities, and it's based on what we have seen from other outbreaks in similar settings, often the same setting, repeated outbreaks. And we know as well, most of these are workers who go back to live in their community, that have live in sometimes very crowded accommodations, multi-generational families. We know that these outbreaks are disproportionately affecting racialized communities, people at lower wage income earners. So those are the factors that we take into account when we're trying to address the outbreaks that are going on right now. And you know what? If we had a lot of vaccine early on, this is one of the tools that we now have to help us manage these outbreaks in our workplaces. And so that's part of the decision making that goes into it. We've always been managing outbreaks as best we can with all of the tools that we have available, and now we have vaccines to add to that mix.
Follow-up, Lisa?
I don't know if this is for you or for the Premier, Dr. Henry, but some of the concerns that people have is this a failure? Like, I think people understand that the people working in these places are doing their jobs and are often doing low-paid jobs and concerned for their livelihoods and living in communal situations or with large families. But for the employers, have they done their part? They're supposed to have safety plans. We're a year into this. What is the repercussions for them failing to keep these people who are vulnerable safe?
Absolutely, and that's, you remember in November when we started to get these rapidly increasing outbreaks, large proportion of them were in workplaces around the province. And we've been working very closely with WorkSafe BC, who have stepped up with us, with our environmental health officers, to increase inspections, to make sure that the COVID safety plans are being adhered to. It's a very challenging job, and what we have found is that some settings, it just makes it that much more difficult. Partly it's volume of people, but it's also the type of work that they're doing. And I bring up poultry plants because we've seen that repeatedly, that even with the best laid plans, with having in barriers, it is very challenging in that environment to maintain the use of the PPE on an ongoing basis. So we have very strategically targeted those places, those types of environments where we're seeing that difficulty despite people's best efforts. So it is a combination of those things, and it is what it is. There's some industries, there's some work sites where it's much more difficult. Yes.
I just want to note, it has been, I think, for everybody in BC, extraordinarily moving to see the immunization that's taken place in Prince Rupert. But it reminds us that COVID-19 is a vicious enemy, that the people of Prince Rupert, the exact same people who were living there last year when we had virtually no cases in that community, it had the lowest rate of transmission. Now we're facing significant transmission. And they are struggling with that. So these tools have been used by public health to respond to this. This is true in workplaces. We've done it in every part of BC, and now we can do it more because there's more vaccine available. But I think it's really important. Of course, we need to have COVID safety plans that people follow. But it's also important to understand that sometimes, and we saw this in the case of the trivia night, sometimes it impacts other workplaces in ways that are very difficult to control. All I can say is we need to have absolute compassion for people who have suffered from COVID-19 in this pandemic. And everyone who has not, like myself, not have been diagnosed positive with COVID-19 should be thankful for that and be supportive of that who are struggling with it. So this is not about blame. This is about an effective public health response with the situation in Prince Rupert and other work sites all over the province, and work sites all over the province is a reflection of that.
Next question is from Binder. Oh.
That I meant to say as well, people being immunized does not mean you don't have to adhere to your COVID safety plans anymore. That is incredibly important. We still have a lot of transmission of this virus in our communities. We know it takes time for immunization to protect me as an individual. It takes several weeks before that protection goes up. But we also know that even when we have a group of people who are immunized, not everybody is fully, that the virus can still transmit. What it does do really well is protect us from severe disease, from hospitalizations, and thankfully from death. And we've seen that in our long-term care homes more than anywhere else. But it does not mean that you get out of jail free card because you're immunized. We need, as a population, for all of us to be immunized, where we can stop that transmission chains in every setting before we can let up on those COVID safety plans in our workplaces. And we will continue to work with the environmental health officers, with WorkSafe BC, to ensure that all workplaces are continuing to take those measures to protect people in those environments. And we, as we in the population, have to do that too. So continuing to wear masks, continuing to keep our distance when we're going to the grocery store, when we're going to our workplaces. So that's a really important piece too.
Next question is from Binder Sajjan, CTV.
Hi, Dr. Henry. Just want to pick up on what you were talking about there. Having the population immunized to a point where the risk is much lower. When do you expect that point to be? And leading up to that point, can you give us a sense of, if things are stable in terms of case counts and variants, what types of restrictions may be eased, in the coming next 2 months?
Yeah, it is a very tenuous time, and I expressed that a few times with my concerns. We've been grumbling along at a very high level for us of cases that we're seeing in our community, which tells us the virus is still spreading. It tells us we still have risk. At the same time, we're thankfully being able to accelerate our program of protecting those most at risk and trying to snuff out some of the outbreaks that we're having and the transmission change that happen in our workplaces. So, these are the things that are going to help us get through the next 2 months. There's going to be very little change in the next 2 months. But the more people that are immunized, the more, whether it's in the workplace stream or whether it's in our main age-based stream, that gets us that much closer. So these things work together to help get us all there. So what we are looking at, and I've had the privilege of working with faith leaders, for example, to look at how we can have small indoor services later in the month, outdoor events, which we know are safer than indoor events. Those are the types of things that will happen first. Looking at whether we can get back to some of the youth sports later in April, and we've approved some very good safety plans from the BC Hockey League, for example, but we're looking at other, particularly youth sports. We want to look at, as we're heading into June, making sure we can have a special ceremony for people who are leaving high school this year. It has been such a challenging year for youth, and I say that a lot, and I've been asked that quite a few times. Yes, I believe if we can continue through this program that we're doing, that we can have something special to mark that ceremony. And the fact that we've all been through this together, but it impacts young people in different ways. So those are the things that I'll be looking at. I've been asked a lot about, can I have a big wedding in April? And the answers are, not April. Keep it small. But by the time we get to the summer, if we get through this program, we continue to have the immunization, we continue to keep stopping our transmission, then yeah, we've been looking by the end of the summer into the fall at being able to have some local gatherings again with larger numbers. You know, some of the arts that we need will be coming online, but we're looking into, you know, by June, if we are able to deliver what we are looking at delivering, and if we're able to keep a third wave from taking off, then we can look at some of those restrictions. And then there'll be some personal things. You know, we've talked as well, and Minister Dix and I have been looking at details of how we can improve quality of life in long-term care and increase our visitation in long-term care now that we have so many people protected there. So that will happen sooner rather than later. And then we can look at our personal behaviors once we get into late in April, May, when we have most of our seniors over the age of 70 protected. Then we can look at whether it's safe to have those visits with our grandparents again, and to keep the elders and seniors in our lives safe in a better way.
Follow-up, Pinder?
Yes, Dr. Ballem talked about swallowing the elephant in the next few months. How do we have enough qualified people to administer those doses? Which organizations, or how are you getting those people? Are you hiring them? Are different people volunteering? Can you just talk a little bit about sort of how to get there?
Sure, I'll start, and then Dr. Ballem can talk about some of the partnerships. But as you know, we issued a PHO order that allows a whole variety of allied healthcare professionals and retired healthcare workers to come back and work in a supervised position as immunizers. Some will be volunteers, physicians, pharmacists, nurses who are doing immunization on an ongoing basis in our health authorities and private organizations. And others will be paid to be immunizers, but we have many other positions that are needed to run a clinic, and Dr. Ballem can talk to that because we've had some great partnerships.
Yes, so we're very fortunate, and you know, I think when the Premier and the Minister asked me to take this on, one of their comments was, this is a good news opportunity for the province. And it's the hope after really a terrible year of suffering and worry and anxiety, and that we really wanted to make this a community opportunity. So we're really happy. The health sector, you know, has obviously, we're hiring staff to do different jobs and have been throughout the pandemic to take on all the different responsibilities. But we also have community partners coming forward to work with us and do some of the work, like registering people as they come into clinics, greeting them. You know, in some of these big clinics, you need runners who can, you know, run vaccine to different immunization stations, and groups that can help oversee the greeting of our population as they come into our clinics. So a whole variety of different areas. And we have community partners both in the nonprofit and the private sector, many of whom have had their workers, you know, basically furloughed for many, many months. So it's been an incredible opportunity for us to mobilize community, get help from various civil society organizations, local governments who have been fabulous across the province, actually, you know, bringing in people, helping us reach people who are hard to reach and make sure they get into immunize. So really an across the board community effort. So, the whole village is helping to vaccinate our public.
Next question is from Richard Zussman, Global News.
Dr. Henry, some of these groups are rather large. You know, I think this slideshow mentioned more than 100,000 people in the education setting. So can you give us a sense of how people within these larger groups will actually be prioritized, and who ultimately is going to make those decisions? Will it be, for example, the teachers or educators themselves, or will it be part of the larger ethical framework?
Yeah, so thanks for bringing that up, actually. I don't know if I said this in there's enough detail, but we will be reaching out to those groups, whether it's, you know, connecting with police chiefs so that they know when to call in. Please do not call into our age-based hotlines. Those are specific for those clinics. We will be reaching out by specific industry, specific farms in some cases, and also be reaching out to the fire chiefs, to our police chiefs. We'll be connecting with the school system to do that in partnership. And we will, the health authorities will be doing this, so reaching out. We know who is in our K-12 system. We know who our child care workers are, for example. So we will be reaching out to you. It'll be a combination through the health authorities, and it will roll out. And as the health authorities are able to organize that with local providers and with health authority-based clinics. And we're doing it based on risk in many areas. So we will be looking at targeting, for example, we know where some of the hotspots are in the Lower Mainland. Some communities are having more challenges than others. So that will be all done through partnerships with the health authorities. So we will be reaching out to you, and it is, for the most part, it'll start early in April. So over the next few weeks, we'll be reaching out and coming up with a plan across the province for addressing each of these areas.
Richard, do you have a follow-up?
I do. Let me ask about the variants of concern. So we've seen this increase in variants. How much could that disrupt what we are seeing in terms of a potential easing of restrictions? And when you balance the priorities around the easing, what sort of numbers in terms of both variants and cases are you looking at?
Yeah, so the variants and the cases are the same, right? So the variants are a subset of the number of people every day that we see, or over the 7-day, the rolling average. But they're detected retrospectively, though we're catching up now because we have this marker test that we do for every positive. So the cases that we've identified that are people who have the variant of concern, and right now the one that we are seeing in BC that is taking over, if you will, same across the country, is the B117. So we are seeing increasing proportion of our cases every day being the B117. So it's not in addition to the cases we're seeing, it's the subset. So the proportion of the cases that we're seeing is now around somewhere between 10 to 12% of our cases every day are now this UK variant. We are still seeing very small numbers of the South African, just sort of sporadic, mostly related to travel. And we've had one cluster of this Brazilian variant that is concerning, but we're managing it very carefully with Vancouver Coastal. So this is a discussion that we've had, of course, around the world, but we had another discussion this morning. What is the impact? What are we seeing? And what we are learning is that some of what the increased transmissibility means is related to what phase you are in a wave or in the timing of the year. So the fact that we're not seeing rapid takeoff with the number of variants. So it's not like they're adding on to the cases we're seeing. What we're seeing is of the cases, they're being slowly replaced by this variant being more common in transmission. So that is, in one sense, it's a good thing that it's the B117. What we're learning, and again, this is science in action, we're learning, and this is something that we have been working out just in the last few days, through some of the modeling, looking at what happened in other countries, is that that one variant tends to replace what other strains you're seeing. And for us, that it seems to be in Canada, the B117, at least here in BC, and Ontario and Quebec, they're seeing the same thing, Saskatchewan. And in a sense, that's a good thing, because that one we know the vaccines are still relatively very effective against, where some of the other, particularly the Brazilian variant, there's concern that vaccines don't work as well. But, things can change. So what we are watching very carefully is, are we seeing things, the variant drive transmission, or are we just seeing it replace the viruses that were circulating previously? And what we've learned over these last couple of weeks is that it's mostly replacement. But that's not to say that that's not going to change if we're not careful, because we do know we have to be more meticulous about preventing transmission, because this one tends to be easier for somebody to spread it to others. So what that can mean is that we'll have to be more cautious for longer if our rates stay as high as they are, and making sure that we get more people protected as quickly as possible and try and break those chains of transmission. So this is all of our challenge right now. At 500 cases a day, with this more transmissible virus replacing a lot of the viruses that were the other ones, we have a smaller margin of error for our individual actions to prevent transmission and our group actions that prevent transmission. So that's our COVID safety plans, that's our making sure our numbers that we get together with are small, that we do things outdoors rather than indoors, so we're not risking that rapid transmission to people. So time will tell, but that's what we're seeing right now.
Next question is from Rob Buffum, CTV VI. Rob, are you there?
Hello.
Yep, go ahead.
Oh, hi. Thanks for taking my question. I guess what I'm wondering is, Dr. Henry, if you're able to sort of elaborate on where we might be at in terms of easing restrictions. You said earlier that by the summer, which would be sort of June 21st, we could expect some restrictions to be eased. Yet you also mentioned that by the end of the summer or the fall is when we could get back to local type gatherings. So, presumably by the end of June or June 21st, pretty much everyone will have had one shot. So between then and the end of summer, what type of activities could we expect to get back to?
Yeah, I know. I wish I could tell you. Unfortunately, I can just give you a sense of what could happen. What I would like to see, of course, is that our transmission drops off, that we have no more clusters and outbreaks, and 3 weeks after all of the younger people that we have in our lives are immunized, we're able to go back to lots of things. I just don't know that yet, and we're all in this same conundrum across the country. We were talking about it this morning with my colleagues across the country. What things can we do first? What things make the most difference? And I will tell you the principles that we're thinking through. One is that the more people that get together indoors, the greater the risk, regardless. And we've learned that. We learned that if you're indoors with lots of people, and it depends on what you're doing indoors. If you're sitting with a small group of people and there's barriers and there's other small group of people and you're not mixing, think of a restaurant, then the risk is less. If you're a larger group of people who are interacting with each other and moving between groups, the risk goes up. So, and numbers make a big difference. And it's not only the numbers, if you have 25 people, the probability that one person has this virus and might spread it to others is less than if you have 50 people. But the other side of it, from our perspective in public health, is we've learned that contact tracing, making sure we can find people quickly and stop that next generation of transmission, is also important in managing the pandemic. So that's why we had, for the longest period of time, a number of 50, because with safety plans in place, with the risk that we had in our community, the risk that somebody might actually have the virus in a group of 50 was pretty low for a long time, and the fact that we could find them and stop ongoing transmission because with our public health resources was pretty high. And then that balance got tipped over in late October into November when we saw this very rapid increase. And, we were, all of my public health colleagues, watching things very carefully. And it really was almost over a period of a weekend that we saw such a dramatic increase. So we learned from that, and we At that point, because our public health resources were getting stretched, we had to stop those indoor gatherings of any size because the COVID safety plans that we had in place weren't working anymore. The probability that somebody, even in a group of 10, was carrying the virus went up, and our ability to find them, because we were dealing with so many cases, had gone down. We're now at a point where we're getting back into a balance. We can follow up on every case. We can find people. We've been having small groups only, so that needs to continue so that we can keep that balance and keep our schools open and keep our hospitals from being overwhelmed and keep our surgical renewal going and keep as many workplaces as we can going. So that's the place we're in now. As we get more people protected and as we try, hopefully, to get transmission rates down, which means the probability that any one person will have the virus goes down, we'll be able to have larger groups again. But it'll be in a slow and phased approach so that we're safe in how we're doing it. So that's kind of a long answer, but is to say those are the things we're thinking about as we move into summer. So how can we do safe graduation? How can we have small, safe gatherings over the summer period? I think I hope and expect we'll be able to get back to similar to what we had in the fall with the groups of 50, and then looking at expanding from there. The things that I think, on the other hand, we're not going to see this year are large international travel. So groups that bring people from many other countries to BC for an event, whether it's a conference or a meeting or a wedding or a family gathering, those things will be dangerous because we know that the vaccine is not available equally to countries around the world. And we've said this from the beginning, the risk anywhere is a risk everywhere. So we're not immune to that. So things like international travel, international gatherings, large festivals that have people coming from multiple places are not likely to happen this year. And things like cruise ships coming into BC are not going to happen this year either.
Rob, do you have a follow-up?
I do, and it's a question for the Premier on behalf of a colleague of mine. Premier, we've heard from a growing number of people with concerns about their treatment in relation to psychiatric treatment, specifically 2 young women who were independently experiencing a mental health crisis and went for help for that at Royal Jubilee. And they've alleged that they were treated in a dismissive way. I gather they've met with you and expressed their concerns. I'm just wondering what your reaction is, specifically in the context of those 2 women, and what's going to be done about it moving forward.
I did meet with Emma and Ella last week. Their situation had been brought to my attention in the legislature. 2 young women who had accessed mental health services as youth and were comfortable and felt that the outcomes were positive for them. And then they transitioned into adulthood and were unable to access the care they'd had before and were put into an adult setting, and their response was quite different from that. I had the honor to talk with both of them and the minister responsible, Sheila Malcolmson. We listened intently to their point, which was why the difference between being a youth and being an adult. I know that Sheila will take that information away, and she's working with Vancouver Island Health Authority with respect to the delivery of mental health services at the Royal Jubilee versus what youth are able to access at Victoria General. But it was a compelling story and one that was quite moving. We're hopeful that that story can lead to changes, positive changes, so that it's not repeated in the future. But the challenge, the most interesting part of the engagement was both Emma and Ella did exactly what we've asked them to do. We don't want to stigmatize mental health challenges. We want to be open and talk about it. Certain media outlets have a campaign that's saying, let's talk about it. The Vancouver Canucks have an aggressive campaign to destigmatize mental health issues, as do we as a government. These 2 young women followed what they thought were the right course, and they didn't get a positive outcome. We need to make sure we do a better job of it, and had we not had the opportunity to speak with these 2 women, we wouldn't be in the position to make the changes they want to see.
We have time for one more question today, and that comes from Tanya Fletcher, CBC.
Hi there. Dr. Henry, when it comes to the second round of AstraZeneca, is the priority order
as per the slides presented today? This is kind of a follow to Richard's question earlier. As in, will you start with first responders, then school staff, and work your way down the list as we see it in the presentation, or will these groups all be vaccinated simultaneously at the same time?
Yeah, so they're not in rank order. It will be some combination of parallel streams as we work out how best to do it for each of the different groups, and particularly for some of the industry groups, we'll have to do it in a phased way over time. So yes, it's not a rank order in any way. We're going to be trying to address as quickly as possible all of the groups as vaccine becomes available.
Tanya, do you have a follow-up?
Yeah, thank you. You mentioned that rules about visits in long-term care homes are still being reviewed, but we have information from a long-term care home operator in Vancouver Coastal Health that outlines some pretty specific changes to the current rules. Can you explain why those changes haven't been approved yet, or when they'll be approved, or will they apply in certain health authorities and not others, or is there some individual discretion here between health authorities that can kind of ease their own restrictions?
So no, there is a provincial standard for that, and it's under a provincial order around visitor restrictions. I know that some of the health authorities have been updating because there were new provisions. We had some discussions about this a few weeks ago from the Office of the Ombudsperson to make sure that it was very clear what the process was for appeal if somebody was denied either a designated visitor or a essential visitor status. And I know that some of the health authorities have updated their guidance to make sure that those processes were much more clear. And I believe that's what you're referring to, but I know the Minister has some comments too.
I think it's exactly that, and these were changes. Some of them were updating, and some of them were changes in the way the orders were made by Dr. Henry a few weeks ago. So I think that's reflected in the Vancouver Coastal Health document, as I understand, as I've reviewed it. And but just to note on the key question of visitation, which is important for everyone, and I think Dr. Henry has made this point, we're going to be making changes in this month of March. It's now March 18th, so that means soon. Either next week or at the latest by March 29th, to the general rules around visitation in long-term care, given the success of our vaccination program. So you should expect that very soon, working with all the health authorities, and we'll be working over the next short period with providers in long-term care on those changes. So those are coming. We have made changes all along about issues around essential visitors, and I believe the documents you have reflect that, things that were announced and were put in provincial health orders a few weeks ago. Je dirais en français qu'on va faire des changements pour la visitation dans les centres de soins au long terme. Ces changements sont nécessaires, bien entendu, après un an de difficultés pour des gens pour vivre normalement dans ces maisons, chez eux, comme un groupe dans la société. Donc, il va falloir des changements. La vaccination nous a donné cette opportunité, ce qui est extraordinaire. Et ça va être une véritable célébration. Et on travaille à fond actuellement pour faire ces changements, et on va avoir quelque chose à annoncer pour tout le monde d'ici la fin de mars. Merci beaucoup. Thank you very much.
Dr. Bonnie Henry, Health Minister Adrian Dix, Dr. Penny Ballem, and Premier John Horgan providing a lot more information about our province's vaccine rollout, including who will get the AstraZeneca vaccine next and how increased supply of all vaccines means that age-based rollout timelines have been moved up substantially. They might actually be completed by the end of June. Some really good news there. Keith Baldry joins us now with more information on this. Keith, first, what Dr. Henry has been calling the parallel vaccine rollout, parallel to the age-based rollout list. These are the AstraZeneca vaccinations, of course, and we now know who's on that list. What are some of the industries included, and why is it important that they are?